Well, good morning, everyone. I love to see those smiling faces. Welcome to Trio Maryland's October meeting. I'm Marty Marin, and this is my wife, Michelle. We like to welcome all our members and guests this morning, and we want to thank you for attending. We do have the presentation on the website already, so if you want to review it as we go along, or if you want to review it afterwards, it is posted already. And today's topic is very interesting. It's the role of robotic surgery in kidney transplantation.
So today we're very lucky to have Dr. Chandra Bhati. He's come to us from India. Dr. Bhati is a multi-organ transplant surgeon, and he is the professor of surgery at the University of Maryland School of Medicine. Also, he is the surgical director of liver transplant and hepatobiliary surgery at the University of Maryland Medical Center. Along with his expertise in liver transplant, living donor liver transplantation, hepatobiliary surgery, and renal transplantation, he is one of the very few surgeons who performs transplant and liver cancer-related surgeries robotically. And that's an awful lot of stuff to have to put on your business card, doctor. We have a real transplant superstar with us today. Thank you, Dr. Bhati, for agreeing to present to our group. Welcome, and I'll now turn the presentation and program over to you.
Thank you very much, Michelle and Marty. I appreciate giving me a time to speak to all the members of TRIO and other patients and families. Again, I feel humbled and privileged to be able to talk to you and in this meeting. As you all know, I've recently moved from Richmond, Virginia to University of Maryland. Today, I'll be talking mainly about the role of transplantation and what new technological advances we have made in last few years in transplantation. Typically, transplantation is known as a very traditional surgery, but we have made a lot of new changes in transplant world to make patients' life better and as well as outcomes better. So when we talk about current status of end-stage renal disease patients, as you all know, that most of the patients who are requiring transplant are end-stage renal patients. Still about 100,000 patients every year are adding on who's requiring hemodialysis as well as peritoneal dialysis. The transplantation is done in a very small fraction number of patients. Only about 10 to 15,000 patients ended up receiving transplant, while most of the patients don't get transplant to the liver. So when we're looking at that, still minority is a challenge. We have a lot more Afro-American patients who don't have access to transplantation, and they have a higher rate of end-stage renal disease. As you all know, that we have a significant amount of organ shortage. Right now, currently about 120,000 patients waiting for kidney transplantation, and out of which we are only able to transplant very few. There are out of this, about 2,000 patients are children, about 98,000 patients waiting or just needing a kidney. Every 10 minutes, we add a patient to a wait list, every 10 minutes. And each day, 22 patients die while waiting for a kidney transplant. So you can understand what gravity of disease we have. That's why kidney transplant is so important in making these patients important life. As we talked, that we are currently adding a lot more patients than we can transplant. So there is a significant organ shortage in terms of transplantation. So we have made a lot more technical advances in terms of patients, so that there are the outcomes, whatever the patients who feel that because of the traditional open cut surgery, whatever in their mind, we can overcome that part. So today's talk, I'll talk about two major things. One is a robotic assisted donor nephrectomy, which is a relatively newer procedure. In the past, we used to do an open cut surgery where we would make a large incision in the body and take out the kidney. Patient will stay in a hospital for a week, and then finally he will recover. It will take 6 weeks for them to go back to work. But now with this latest technology, which is minimally invasive, patient can go home on a pretty much day 1 or day 2, and they return back to work most of the time in 2 weeks' time, which is a significant improvement. Same thing, we'll talk a little bit about the robotic assisted kidney transplantation. We are the first one who did the living donor first robotic kidney transplant in the state of Maryland. I did the first one in other states before I moved here, done almost more than 50 kidney transplants using a robotic technology. So this is a significant improvement. And today I'll talk a little bit why it is a significantly more improved and why it has a better outcome in comparison to patients who receive open kidney transplantation. So when we talk about the donor nephrectomy, this is unfortunately, I can't show you the slide, but I put a picture where it shows that typically when a patient have a surgery, how big cut they get. While they have a robotic assisted surgery, they have only about 7 centimeters scar. When we do an open surgery, the patient has anywhere between 15 to 20 centimeters scar. And as I mentioned, the benefit to the patient is significant. Patient goes home on a day 1 to day 2. We do the surgery by retrieving through the bag. We don't typically put a hand. We've done over 200 patients, and all of them have done extremely well. None of them have required conversion to open surgery. So there is a significant benefit as we talked about. So when we're looking at this, most of the patients who we do about 40 to 50 cases a year, and average stays just 1 to 2 days. They eat on the same day, they walk on the same day, they start taking pain medication by end of the week, which is a significant improvement. Imagine a patient who's a 25, 30-year-old person who's otherwise healthy can go back to work in about 10 days and no pain medication, and everything is much better recovery. So the barrier where a patient typically had to take off for 4 to 6 weeks is no longer there. So when we talk about robotic kidney transplantation, first robotic kidney transplantation was done in year 2002. Though it didn't actually mature up till 2010 when we started using these for patients who are morbidly obese. So just to give you an idea, if a patient has a large penis, and if you do a kidney belly, you will realize that the scar which is there is likely to get infected because if the wound is low down, it touches the thigh. And in a bigger patients with a high BMI, the wound infection rate is up to 30%. So in these patients, it definitely has a way more improved chances of success. It has all the benefit which is there for minimally invasive approach, which is early recovery. There's a very low chances of wound infection. We have had multiple papers which has published, including ourselves, which shows the patients whose BMI over 35, the chances of wound infection is about 30%. So every 100 kidney transplant we do in a patient whose BMI over 35, 30% of these patients will get a wound infection. Whenever they get a wound infection, we know that it has a bad outcome on a patient's survival. So the patients who go through the robot, their wound infection rate is less than 5%. So there is a 25% improvement just by this technology. And cut, there is no cut lower down. I wish I could show you the pictures. Whenever you get a time, go and see on the website, and you will see the cut is only about 7 centimeters size to put a kidney through the robot incision, and rest all the surgery is done with the robot. So it's a significant improvement. Again, when we do the open traditional one, we cut the muscle. When we cut the muscle, patient get a significant amount of pain, increased chances of hernia, and patient ended up staying much longer in a hospital. While when we do with the robot, we don't make any cut incision. If we are not making a muscle cutting incision, patient doesn't have pain. And again, by the most of these patients are off pain medication by end of the week. So again, imagine a patient who's staying in a hospital for 4 or 5 days versus going on a day 3, recovering much faster, again, less chances of wound infection. So these are the benefit for these patients who are receiving robotic assisted kidney transplantation. It has some disadvantages because it's a very technically advanced procedure. Not many surgeons can do it. Still across the US, there are only a few surgeons who does this procedure routinely. We are one of those few people who do this surgery routinely. It does definitely has an increased cost associated with it because robot costs a little more than the open surgery. But when we look at the patient's benefit, the cost is insignificant. The reason is if a patient who's having open surgery and patient ended up staying in a hospital for 5 days, versus if patient had a robot surgery, the patient stayed only 2 days. So the cost get navigated just with the surgical aspect of this. Patient, again, imagine a patient who's not going to work for 3 months versus patient going to work in 4 weeks. Again, you have economical viability of 2 months back to the patient's life. So there are a lot more advantages in terms of having these patients receiving a kidney transplantation. Again, there's a picture which shows how this procedure is done. Again, go on a website, have a look, and you will surprised to see that whoever has received a kidney transplantation will see that the incision is only about 7 centimeters and it's just about the belly button. So it's a much, much smaller scar than the typical scar what you have seen it in there. And those pictures clearly depict the huge benefit of having this surgery in these patients. There are a lot of literature has published which shows that there is a significant improvement in these patients who receive a robotic kidney transplantation. One study from Chicago, where I was before, we published the data about 240 patients who receive a robotic assisted kidney transplantation, which shows the risk of wound complication is only 3.8%, as I was talking, less than 5%. So this has significantly shown an average BMI in these 239 patients was 40. So you can imagine patient is much bigger in a size, but much, much smaller incision. Only would have a significant benefit with no difference in outcome of a patient survival and a graft survival. The 1-year survival was 98%, which is a pretty good outcome. If you do 100 kidney transplant, 98 patients survives 1 year. So this has shown that the robotic kidney transplantation is a very safe procedure, has an excellent graft function. Patients feel much better with this kind of approach because they're cosmetically better, less scar, return back to work. All these benefits come with this technology. Again, one of the pictures showing up there is that when you have this wound infection, how bad it looks like versus when you have a robotic kidney transplant, which patient looks much better, feel much better. We do put some ice in there because the kidney tend to get warm. So there's a couple of pictures which is showing how we put the ice there, how we make the kidney keep cool during the robotic technology. Since remember, there's no hand going in there. So we don't have any hand touching the kidney. Everything is done from the instrument which are far away. So those instruments make a difference in terms of how we get there, how we connect these things. And we connect the vessels with the robot using sutures. Again, it has shown that it has a significant improvement, significant benefit in a patients who are obese patients. There's recently a data published from, again, Chicago group, which showed the patient who have a bariatric surgery, like a sleeve gastrectomy, at the time of robotic kidney transplant, they lose weight much quicker and a surgery is safe. So rather than having a two-step surgery, you can do both in a one go and still have the same outcome. Patient loses weight much faster, even though surgery take a little longer, but they do overall much better in comparison to the patients who are big, morbidly obese, but they ended up staying hospital. And we know that the patients who are morbidly obese tend to have a much higher rate of diabetes, high blood pressure, all these complications which are associated with it. This is another one which is where we think has a significant benefit. And that benefit is in terms of patients who have a nutcracker syndrome. And those patients with a nutcracker syndrome has typically a benefit in terms of having surgery. And that shows that when we do the nutcracker syndrome, these patients, we take out the kidney at the same time and transplant at the same time. So there is a definitely much more benefit in these patients for transplantation. So there are benefits in terms of transplantation in these patients. Sorry, I'm moving to reduce the voice which is coming from the background. So this is, we have done 8 patients with the nutcracker syndrome. And these patients typically have a compression of a renal vein where we remove the left kidney and put it back into the patient. So imagine just in a one surgery, they have kidney move from the left side to the left iliac fossa. These patients go home on a day 2 and they do much, much better rather than typically these patients required having a surgery in 2 steps where they would take the kidney out, flush it back and make a second incision. So it was way more cumbersome than this thing. So this is again, a significant improvement in terms of these patients. This is again, we recently did actually in a polycystic patients who have a large kidneys, they typically require incision from top to bottom. And in these patients, we do with the robot, so they have only about this size scar and we can take out this size big kidneys out of these patients. And these patients do tremendously well. They go home on a day 3, typically where they stayed for about 7 days in the hospital. So these patients with the large kidneys, we remove those kidneys and put it back in at the same time. So again, it's a huge benefit for patients with the polycystic kidney disease. We recently presented this data in American Transplant Society meeting, showing that this patient can be benefited just with the one surgery. So we are again one of the few centers who do these kidney transplant with the robotic technology. We did the first living donor robotic kidney transplant in Maryland in last year. Till now, we have done about 10 transplants, out of which we have done combined. Most of them are living donor. We have done about 6 of those with the polycystic kidney removal, where the polycystic kidneys were removed at the same time. Average BMI is 29. The highest BMI was 45, and we have used in all ethnicities, male as well as female. Median hospital stay in these patients for about 3.5 days. They ate on the same day, they walked on the same day. The pain medication was off by end of the week, and their creatinine was pretty good at the end of 3 weeks, pretty normalized. There is again a picture how it looks like after 6 weeks. You can barely see the scar. These patients do extremely well. I could show you the picture and you will see that scar is almost disappeared, and patient doesn't have any scar in these patients. And this is the team again from us. I know I rushed a little bit just because the presentation is not there. I rather want to have a talk and answer you any of your questions in the form of any Q&A. So please feel free to ask any questions, whatever you have.
Doctor, you're my hero. I mean, coming to us from India, moving from room to room. I mean, you're just amazing. So thank you very much. And again, we apologize for the little issues here today. You do have a question here. And are there issues with using robotic surgery to connect the urethers to a transplanted kidney?
No, there is
Dr.
there is no issues in connecting the ureter. Actually, in a patients who have a ureteric stricture after transplantation, those patients actually we do this with the robot as well. So there is no issues in these patients which we do it with the robot. So it is technically actually pretty easy to do it, and the patient do very well.
Please discuss the need for a nephrostomy tube and any related risk. I'm sure I didn't pronounce that correctly.
No, there is no nephrostomy tube. Actually, we don't put any nephrostomy tube in a kidney transplantation. So we only put a stent after transplantation, and that stent is same like an open procedure, and that stent come out in about 2 weeks. So there is no additional need of a nephrostomy tube during this procedure. And there is no real risk.
Thank you. How many centers in the United States are currently able to do this robotic assisted surgery?
There are very few centers who are doing this. I would say in a country less than 10 currently who are doing with the robotic assisted. There are centers who have done 1 and 2 and stop, but most of the centers are not doing it. There are very few centers who are doing this with the robotic technology.
Where did this start then? What country developed this? Or
so the first one was done in Chicago in 2010. Before that it was done, but that wasn't a purely robotic technology. So first real robotic surgery was done in 2010. And after that, we did it in 2016. So it took even 6 years for other centers to adapt, and still very few centers across the country are doing it.
Thank you, doctor. Where is the stent placed?
So stent is placed in the same ureter where typically we would do it in an open surgery at the same place. We would do it. There is a same place it goes into the bladder and a ureter, and we do it when we are anastomosing the ureter to the bladder at the same time.
Do we have some more questions?
Doctor, if University of Maryland has done so well with this. How long do you foresee it being that it becomes a mainstay at a lot of hospitals? If
Well,
it's a better way of doing it?
I think it is a better way of doing it. The only problem is, as I mentioned, the technical expertise is not there. People are getting better at robot. So I think in next 5-6 years, when more and more people getting trained at the robot, they'll be doing more people will be doing it. But right now, there are not enough people who are trained to do this kind of a procedure.
Do you see that being the problem for this type of technology going to other organs?
Well, we are already gone to that. We are already using this technology into the liver aspect as well. The liver donor are doing with the robotic technology. So this technology is already being used in way more other organs. The only thing which we haven't done is the recipient part, but we have done the liver donor, we have done the kidney donors, we have done the kidney recipient. So we have already moved way far ahead into this technology.
Thank you.
You said it is more expensive. Does that make it then prohibitive for some transplant centers to be able to entertain doing this?
I don't think it's the expense is the issue, because it's still the price is, as I mentioned, when you compare all the lump sum to get a patient who's admitted longer, when you combine all these costs, the cost is equivalent. There's no major difference between these two costs.
So then there's no
And-
issue with insurance companies or anything? There's no
No.
problems?
No, there is no problem overall, because at the end of the day, when you compare these costs, they all come to the same thing.
Any other questions? Everyone's being shy today. We usually have,
Can you get a robotic surgery after, as a second transplant, if you needed if your first
Yeah,
one
you
fails?
Yeah, you can get it, because there is a left side is still there, so you can certainly get a kidney transplant on the other side too.
that's great. That's super. Again, we apologize for the inconvenience. When we have this session edited, we will ask the service that handles that for us if they can possibly put your presentation in and include it with your audio, so that maybe that will make it easier for everyone. But I definitely will send out the link to your presentation. It has great pictures in it and a lot of information. So please make sure that you look at that. Anything else you'd like to add, Doctor?
I think, Michelle, there are a couple of more questions. After you remove the donor kidney robotically, you still have to put it in the recipient kidney. No. That's the whole point. We take out the kidney robotically and we put the kidney back robotically. So we do both with the robotic technology. So we're doing both procedure, even transplant. That's the whole point. The transplant, we're doing it with the robot, so that the patient doesn't have to go through the open traditional way. They only have about this size scar, and that scar is needed to drop the kidney in. And once we drop the kidney in, rest everything, we can sew it with the robot. So no, definitely not. We do it with the latest technology. What about the liver transplant? Well, I hope we get there. We're not there yet, but I think in the next 10 years, we might get there. But right now, we are definitely doing donors with the robot. So the liver donor, we are doing with the robot, but we haven't got to the point of robotic liver transplant. Another question is, how does this procedure take? You mean, how long does procedure take? Once you have become a proficient on the surgery, it takes the same time as the open procedure takes. On an average, my robotic kidney transplant takes about 3 hours. So which is pretty similar to any open procedure. It's exactly the same time. There's no much difference between those two.
Anything else?
At this point in time, though, you're doing all of these procedures with living donors?
Can you repeat the question?
At this point in time, are you just doing the robotic assisted surgeries with living donors for the recipient?
Right now, we are just doing with the living donor recipients, because we don't have availability of robot for the deceased donors yet. Hopefully, we will get a more and more availability of timing of robot, and we can do more deceased donors. But right now, unfortunately, the living donor is the only way we can do it, because of it's a schedule, and getting a robot time is a little harder. But I think with the coming time, it's going to be more and more become available.
Thank you. Does Medicare pay for this procedure?
Yes. It's no cost to the patient. It's the same cost for patient, and it doesn't change anything from the patient point of view.
And thank you. Is this a feasible option for those of us who have had multiple traditional kidney transplant, specifically regarding potential excess scar tissues?
Well, it is, again, it's hard to say whether it can be done or not till I see you in a person, and then we can decide whether it can be done or not. We have certainly done in a patient who had multiple surgeries, but not in all the patients. So this
It's
can
like-
potentially be challenging, but it can be done.
Excellent. I think this is fabulous. I mean, you know, such an excellent topic. You're awesome. I mean, we're going to have you back. And you do come back to the United States, right?
I'm coming back next week. I'm just here for a conference for like 3 days, 4 days.
Well,
Well,
good.
you're the best. I'm telling you, I am so impressed, and I want to see your business card, because all the things that you're an expert in, I want to see how you fit all that on your card. Any other final questions for Dr. Bhati from the University of Maryland Medical Center?
Okay, well then we would like to thank you, Doctor, for joining us today. And I'd like to thank all of our members for joining us. We love seeing you all. Check out our website at www.triomaryland.org. We do have the doctor's presentation on there under speaker notes, just in case you want to review it right away. And all sessions are posted to our YouTube channel for your convenience. Don't forget to check out our Facebook and Twitter, like us on Facebook, and we like to wish everyone a safe and healthy fall weekend.
Man, I want to
Thank you
buy
very
you,
much.
I want to buy
Bye-bye.
you coffee when you come back to town, doctor.
Definitely, we'll meet in a person soon.
Okay,
Bye-bye.
super.
Thank you, Doc.
You're the best. Thank you.